everyone's anatomy is so different, and there's multiple nerves that supply the nipple, and sometimes it can be stretched and it's not happy when it does that.
Hi, you guys. Welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm Dr. Ashley Amalfi. I've got my girl here, Dr. Smita Ramanathan, two board-certified female plastic surgeons. Hi, girly. We are talking about breast augmentation. We are looking at your most common questions and answering them today. So, Smita, do you want to start off with the question of the day?
Yes, the question of the day is, will your nipple sensation change after a breast augmentation? Now, I know a lot of people are worried about this. It's a very common question, right? That's a highly sensitive area, and we certainly don't want any changes. So what do you usually tell your patients, Ash?
It's a possibility. It's a low risk, certainly less than 10% of the time that you have decreased or changes in sensation. You can also have increased sensitivity to your nipples after surgery as well. But it is a risk. We are working in that area, and sometimes that nerve does not like to be stretched around a bigger, larger breast. So it's something to consider, but it's a very, very low risk. What do you say, Smita?
Same thing, of course. This is what I say.
We're so aligned. I love it.
I know.
We don't even have to talk about this stuff ahead of time. I listen to it come out of her mouth, and it's like I'm speaking myself.
Exactly. No, I mean, I tell everyone, if we are operating in the area, of course, there's always going to be a risk that there's going to be something happening. Most often, especially in breast reductions, which is not part of the topic, but you'll have increased sensation, then it sort of goes back to normal. But again, everyone's anatomy is so different, and there's multiple nerves that supply the nipple, and sometimes it can be stretched and it's not happy when it does that. So I've never had someone, though, complain about it. Even if they have decreased sensation, they're just so happy and confident about the appearance of their breast that it's not necessarily a concern, but definitely something to be aware of and to think about.
Yeah, so essentially worth the risk for most people. And again, it is a very low risk. And again, even if you lose it temporarily, it might not always be permanent, but it could be. Yeah. And you just have to weigh that option. But again, people are just so happy after this surgery. So even though it's something we're worried about, and we obviously do everything in our power not to have happen, if it does, I think you're still going to have a great result and feel really great about the way that you look.
Yeah. I mean, I would say this surgery is like 10 out of 10 people are ecstatic afterwards, right? No matter what. It is a very great procedure. But we love answering all these questions, guys. So if you do have questions, make sure you comment and let us know, or DM us on Instagram, and we'll be sure to answer them. But in the meantime, tune in, subscribe, Lipstick and Lipo on YouTube and Spotify, and we'll see you next week.
All right, guys. See you next week.